Hi Gab, thanks so much for taking the time today. I'm really looking forward to hearing about your journey and your experiences about nursing. The idea of this conversation is pretty much to learn about your role and your understanding of both health and well-being. So before we begin, I just wanted to ask how your week's been so far.
My week's been pretty good. I'm currently a student nurse. I'm working in the hospital in a rehabilitation ward. So I feel like this conversation can really explore that in-depth communication, that relationship that we have on an interprofessional level.
That sounds good. Could you tell me a bit about your journey into nursing and how that led into your profession?
Yeah, so it really started off with my grandfather because he was a paramedic for 40 years.
Oh, that's a long time.
Yeah, it was a long time, and that really kind of prompted me to look into the medical field. And I really found joy in working in the medical field as I do at the moment. I feel like me starting off as a nurse will allow me to build on my long-term care strategies that I can utilize for patients. And then later on in life, I can work towards being a paramedic where I provide more immediate, fast care.
That sounds like your grandfather actually had a really big influence in your career.
Yeah, he really did.
Okay. Well, how do you see your role in a healthcare team and how does it connect with other professions such as physios?
I see my role as a student because I am a student nurse so far, but I feel like I utilize all the information, all the theory that I've gained over the last couple years. I've been using that information to provide better care for the patients, and then that allows me to work on communication between my buddy nurse, physiotherapist, and other healthcare workers.
That's really interesting. Do you have an example of how that interplay happened with a patient?
Yeah, actually, today, for example, we had a patient who's just about to be discharged, and he had a physiotherapy session due. So when he presented himself to the physiotherapist, he was actually pale, sweating, and he had shortness of breath.
Yep.
He stated that he was coughing up green sputum, and that was handed over to us, communicated to us by the physiotherapist. I feel like something like that can be easily missed by nurses, and without the help of physiotherapists, we wouldn't be able to provide the correct interventions to lessen his discharge process.
That makes a lot of sense. What does health and well-being mean to you, and how do you see it helping and shaping your professional role?
Health and well-being to me, they both mean happiness. I feel like they're both intertwined and they both rely on each other. And so if one is missing, then true happiness, a true quality of life cannot be achieved. So I feel like it's important as a professional to maintain both health and well-being on an emotional and physical level for the patient.
Yeah, that makes total sense. Would you say that influences how you react with patients on a day-to-day basis?
It does, because I feel like patients can find being in a hospital daunting.
Yep.
Patients, even being patients, is stressful, and for them, that can have an effect on their emotional status. So us providing the best comfort will allow them to feel better.
That makes total sense. How do you apply your understanding of health and well-being, both personally and professionally?
I feel like making sure that me as a healthcare worker is that I have a good health, I have a good well-being, and I'm healthy.
Yep.
Will allow me to provide better care for the patient. I feel like if I'm not good, then I can't provide better care for the patient. I can't make them better.
Yeah, that makes sense. Do you find that there are challenges in balancing the two?
Yeah, I definitely do. I find that challenges, one of the biggest challenges in healthcare would be communication. I find that everyone just doesn't have the time, and they're often rushing around, and they don't have that time to sit down and communicate with another healthcare professional.
Yep.
So that can allow for a bit of miscommunication. So that's a big challenge, but a reward out of that would be when we actually do communicate well, we provide better care for the patient, and then in the end they are discharged quicker.
Interesting. What are some challenges and rewards you've experienced, and how do you usually manage them?
Yeah, so kind of one of the biggest challenge, like I've mentioned, what would be communication. That everyone is everyone's short of time. We only have an 8-hour shift, so we don't have that time to communicate with the patient, communicate with other healthcare workers, and communicate to each other in general. And so when we work on communicating that, we can reward ourselves by making the patient feel better. And then, they often will thank us for it, and that is a reward in itself.
That makes total sense. Could you share an example of how collaboration with other health professionals has shaped patient care?
Yeah, so there was a lady that was recently admitted, and she was admitted because she had a fall, and the lady required a referral from the physio, so we referred for the physio, and the physio came and they assessed the lady, the patient, and found that she was using the incorrect mobility aid.
Oh no.
Yeah, and so by through the physio's help, we're able to give her the correct mobility aid, and then she was able to mobilize safer, and that's even better for her and the family.
Yeah, that makes total sense. That's a great example. I can really see how the teamwork actually improved the patient outcome. How do you see your profession evolving, and do you see the interprofessional teamwork developing in the future?
I think nursing and the healthcare system will evolve quite a bit in the near future. But there is actually this one new system that I'm curious about, and it's called the AI triage system.
Oh, yeah.
Basically, all it does is it records and notes a whole face-to-face interaction that you have with the patient, and it actually makes notes in the background about it and provides information, provides prompting and interventions that may be missed during a normal face-to-face conversation.
It makes it a bit more in-depth.
Yeah, it definitely does. And then that being as in-depth as it is, will only allow the healthcare teams to communicate better on a deeper level.
I feel like that would streamline the process a lot for that whole process of admissions to discharge.
Definitely, it would streamline it and make it a timely, accessible healthcare system.
I think that also changed the way we work together as well.
100%.
Well, thank you, Gab. It was really insightful from what you've shared, and I've learned a lot about the importance of that interplay between both our professions, and how nursing brings a unique perspective to the healthcare team. It's clear how the collaboration actually improves patient outcomes. So thank you for your time.